transverse arytenoid muscles. Let's talk about a few of the other things. There is swallowing. When we swallow, the food does not go into the larynx usually in a normal person. The food does not go into the larynx because their aryepiglottic folds have a sphincter functions. The aryepiglottic fold come together, narrow, become narrow, and they strong. They close the fold. The other thing is elevation of the larynx. When we are doing the swallowing, the whole of the pharynx is pulled up, and along with it, the larynx is pulled up. When the larynx is pulled up, the epiglottis here, there is a tongue present right here. When the larynx go up, the tongue is pressed against the larynx, is the epiglottis of the larynx is pressed against the tongue, and it turns like this. So it acts like a lid covering a lot of the opening, but it is not a perfect seal. And the perfection and the most important thing is the closing of the vocal cords. The closing of the vocal cord is the most important one. The vocal cords attach so much close to one another that they don't allow a drop to pass through. And that's why when you're swallowing, due to the elevation of the larynx, due to the constriction of the arytenoid folds, the food usually go through this pathway, through the piriform fossa. Some may jump over it, and during the jumping, if somewhat go inside, it is stopped by the arytenoid cartilages. It is locked by the vocal cords. You may have done it in your, you may do it now, or you were doing in your childhood, that when you were drinking a soda, Pepsi or Coke, if you just don't swallow, resist a little, and let the Pepsi to go to the back of your throat, it actually goes and touches the vocal cords. That's the sharp signal, that's the sharp sensation you feel. That's the swallowing. Phonation, that is a production of the sound. Phonation consists of the pitch, that is the thinness and thickness, deep sound or not. Intensity mean loud sound, and low sound. Quality and articulation. Quality means, um, even if mine like this, I'm talking like this, but if I close my nose, you will feel a difference in the quality of my sound. This is the nasal quality of timbre. So this is the quality. The pitch, it is usually due to the frequency change. The denser the vocal cords, the thinner, the higher the voice will be. The relaxed the vocal cords are, deeper the voice will be. The intensity is by the amount of air that is passing through. If you get a lot of air, the vocal cords will flap a lot and the voice will become high. But if you push some sound, the vocal cords will flap with a less amplitude. So pitch is due to the different frequency. The intensity is due to the higher amplitude. When you're talking loud, the vocal cords are doing like this. And when you're talking slow, the vocal cords are doing like this. When you're talking high pitch, the vocal cords are doing like this. When you're doing low pitch, the vocal cords are doing like this. The quality, it depends upon the chambers above. It depends upon the sizes and the functioning of the paranasal sinuses. It depends upon all the chambers, the vestibule, the larynx, the oral cavity, the nasal cavity. Your voice drastically change when you have a flu because a lot of your chambers has a fluid then. The articulation, the formation of the words, it is due to the movement of the muscles of the mouth, the lip, the tongue, and it's touching on each side. On when we are whispering, when we talk like this, we are actually closing the vocal cords and only separating the arytenoid cartilage. So the sound exits from the back. The whispering is very wasteful for the air. Try to count from 1 to 100 in one breath while whispering, and try to count from 1 to 100 while speaking normally. You will get further when you are talking normally because the slit is closer, the slit is more close near to the close closing point in the phonation. In the whispering, a lot of air is lost. You can't whisper alone. The whisper ends your breath very quickly. Then there is muscular efforts. We have talked about it, then we will talk about it in the thorax lectures. When you are lifting a lot of things, when you're lifting a heavy weight, you produce a grunting sound. Like if I try to lift the table in front of me, it's like this is the grunting sound. Why it's doing like this? Because when we are lifting anything heavy, our vertebral column tend to collapse on itself in the anterior aspect. It needs every possible support it can get. The a lot of it is coming from the muscles of the back, but our diaphragm helps in such a way that diaphragm goes down all the way down. It, you take in long inspiration, and then the vocal cords play a role and they tightly oppose with one another. So the lot of air that has gone inside the lungs, it is trapped. When the air is trapped, there is a high pressure in the thorax. The diaphragm has pushed down on the abdominal cavity. There is high pressure in the abdomen. The abdominal muscles are contracting and they are increasing the pressure in the abdominal cavity. Furthermore, so this acts like a football in front of you. You can't bend your torso because of so much pressure inside. It's like a balloon. When it's near empty, you can fold it in all directions, but when it's tight and full, it is difficult to bend it. Why? So you act like a balloon with air trapped inside, and the glottis count. And the glottis is trying so hard, the vocal cords are trying so hard to close it, and the little sound that exit, it comes out like a grunt. It is basically a little air leaking through the closed vocal cords. And this closure of the vocal cords help you in maintaining your body posture, in lifting the heavy things. This closing help you in coughing. You close it, trap your air inside, close it, build the pressure, and then open it suddenly, and then the cough comes out. The same things happen with a sneeze, and the same thing happens when you are going to the washroom. You are doing defecating or micturating. Vocal cords are closed, and you put pressure, and it helps in overall raising the abdominal pressure because as the diaphragm comes down, if the vocal cord is open totally and you exert in the washroom, the air will come out and the pressure won't be transmitted down to the abdominal viscera. So that is why the person who have a permanent tracheostomy tube, the person who cannot close their vocal cords, they tend to get more constipated. They are advised to take care of it. They are advised to look for it, that they don't get any constipation.